Good morning. This is Edward Ng from the Pittsburgh Foundation. Welcome to another COVID-19 response update call. Just to let everybody know that the session is being recorded and will be published for the consumption. And if you would hold your questions or put your questions in the chat box, and we will try to answer those after the call. That said, I'm going to hand it over to Alyssa Cholodowski.
Thank you, Edward, and good morning, everyone. I'm Alyssa Cholodowski from United Way of Southwestern Pennsylvania. Unfortunately, McCray Martino from the Community Foundation of Westmoreland County is not feeling well today, so she has asked me to facilitate the meeting. So that's what's happening today. So you won't see McCray, and Sarah Stenger as well is unable to attend. So to begin with, and my most important question to McCray was, how about the artwork? Where's the description? And I was happy to receive it from Allison. So thank you, Allison, who's running in the show in the background as well. So this beautiful painting is from the Westmoreland Museum of American Art. It's by Russell Smith, who gravitated early to painting nature, recalling that as a child, he drew from his mother's china plates decorated with landscapes. This painting is called The Aqueduct of the Pennsylvania Canal below Harrisburg, Pennsylvania. And Smith reveals his interest in both the engineering feat of the aqueduct as a means to transport boats over land and the surrounding landscape. Breaking light directs our attention to the human figures in the scene, who appear minuscule when compared to the landscape surrounding them. So a beautiful autumn painting, and it is quite striking. So always happy to have that beautiful start to our meeting. Thank you. So next slide, I believe, is me and McCray. So McCray, if she has any reports, I'm sure can send them out to this group later on. For United Way, and in particular for 211, I wanted to just provide the September 2021 numbers and quote that we had from a caller. PA 211 Southwest told me what help I was eligible for. I couldn't have figured it out by myself. And that's exactly what 211 is about. A lot of people simply don't know where to turn. They don't know all the resources that are out there. They don't sometimes even know what questions to ask. And one thing can lead to another. Often people are not struggling only with housing, but with food or with employment. And that's why 211 is such an amazing resource. And we're fortunate to have a great team that works at 211 as our resource navigators, just a wealth of knowledge, and also an easy thing for someone to make the phone call. So just in terms of numbers, in September, there was 1,083 calls and 1,287 texts, which both numbers are up from the previous year. In particular, at the same period of time in 2020, which, as we know, we were still in the pandemic at the very beginning still, there was 882 calls. So you can see that the numbers continue to climb, people continue to call. And I think part of it is that now people know about the resource as well, and they know the availability. So that's a good thing. Continue to see most of the calls coming in for utility assistance, electric, gas, and water help. Also, housing is the second biggest request, and we have people asking about the rent payment assistance. And I know Dan Carney and Commissioner Chu and Commissioner Sorelli Thrasher will be speaking about that and what's available there. But also calls are coming in for low income and subsidized housing, emergency housing, shelters, and such. Continue to see a steady number of calls for food, which has gone down. And I know Jen Miller from the Food Bank will be talking about that, but I think that's a good thing, that people are finding that they can access the food that they need and they're not calling in a crisis for food. So that's the 211 report. Just in terms of demographics, I always think it's interesting. 75% of the calls are from women, and 25 obviously from men and others. The age range is 45 to 54. So we're seeing a lot of people kind of in that age range who are calling for help. A little bit more in the 23 to 34, higher than the seniors. So I think we're seeing a younger group of people calling for help, whereas before I think the numbers skewed a little bit higher towards our senior population. Not a surprise again about the zip codes where we're having the most calls are from the Greensburg zip code 15601, New Kensington, and Jeanette, and then the fourth highest from the Irwin/North Huntington area. Highest referrals are going to Catholic Charities, the Diocese of Greensburg, just an awesome partner in the community, really great wealth of resources and help for people. People are also calling for the ERAP program, Union Mission, and for our United Way Southwest PA Emergency Basic Needs Funds that's helping individuals pay some of their utility and rent assistance as well. So just wanted to give a quick overview. I know many on this call are responsible for providing these resources out to our citizens in Westmoreland County and beyond. And I think it's good to see the work that is being done and the partnership that's come together to make this happen and the availability. And I also wanted to thank in particular the county commissioners this past year provided some terrific funding for 211 through the Human Service Development Fund. So thank you for that. That really helped out a lot. So with that, I will move on and happy to provide this 211 report to anyone who's interested, or also talk more about 211 offline with anyone. Next up is our county commissioners, and we're so thankful to have them with us today. First is Commissioner Gina Cerelli Thrasher. Commissioner, take it away.
Great. Good morning, everyone. I just wanted to say good morning and thank you for everything that you are doing. We are seeing light at the end of the tunnel here with COVID, and we're just hoping that we're moving it in that direction and continue to increase in vaccination rates. So again, just want to say hello, and my colleague Commissioner Chu has a lot to go over, so I'm going to pass it over to him. Thank you.
Good morning, everybody.
And his slides we could go to. Sorry.
Can you advance one more? Good morning, everybody. Hope everybody's doing well today. I'll echo my colleagues' remarks of thanks for everything that the community does. Everybody that's on this call is a great partner, whether it's public safety or Excella Health, Dan Carney and the Union Mission or the Food Bank. So we interact with them regularly, and I really appreciate that camaraderie. It's really made the last 2 years of being a brand new commissioner much easier. There's very little new stuff that I have today, only a couple pointers. The Emergency Rental Assistance Program is still ongoing. We've only given out about $3 million. There's about 20-some million dollars remaining. Dan Carney's scheduled to be on the call, and it sounds like from the 211 presentation that Alyssa gave that there are more people knowledgeable about this funding, and hopefully we can work to get that out. It does cover utilities and rent, but it doesn't have to cover all of those items. And so if you are behind in utilities and you are in a rental situation, not a homeowner situation, it would cover just the utilities. The next item is the CPACE program that we put in place. The policies and the administrator are up and running. There's no cost to the county, but private property owners can utilize this low interest long-term loan to make their facilities more energy efficient. And that, of course, saves on gas, electricity, and other costs, which have been going up and up and up over the last couple of months. Next slide, please. The American Rescue Plan, the final rules are still not posted. I suspect that come the December presentation from Alyssa and McCrae's groups that will still be a bullet point, unfortunately. But the thing that is new this month is that the 3 commissioners have scheduled public comment for October 28th from 11 a.m. to 2 p.m. and from 4 p.m. to 7 p.m. It's at the Westmoreland County Community College at their Youngwood branch at the Science Hall Amphitheater with the address in the slide. That is fully ADA accessible. It's a fairly large room. There will be soon a link provided for signing up to pre-register for the conference, although that is not required, and you can sign up the day of the public comment until 1:30 p.m. or until 6:30 p.m. in the evening. For those of you that work with veterans, I've often heard that finding the DD-214 after you've been discharged for many years can be a challenge. The Recorder of Deeds office is now authorized to record military discharge papers of all veterans, and they will give you a little ID as a result. And that's a great way to keep that information accessible to the entire family should something happen to a veteran. Next slide, please. The Healthy Homes and Lead Hazard Reduction Program is not new, but I just like to keep reminding people of it. There has not been much use for it, and this is something great that I think can really build up the homes for our younger constituents and our younger citizens in Westmoreland County, especially those who might live in poverty level conditions. Next slide, please. There's a lot of ways to remember these URLs. I know a lot of them are long. You could call the phone numbers at the top of the slide and we can get the URLs to you, or you could email my colleague and I, and we can definitely reply with any questions that you have about this program. And then the last slide, please. This is just a little bit of a shameless plug. As a member of the Westmoreland Land Trust, we are doing the first ever Westmoreland Ramble. It's a road rally type of event. It's open to professional road rally folks as well as novices who have never done a road rally. One of the things many people learned during the pandemic is that it's important to take a break, to relax a little bit. And so you can enjoy a break in nature with a little bit of a challenge. There must be 2 people in every car. You'll be given a set of questions and you'll be given a map of a route. And as you go through the route, you and your partner find the answers to these sometimes devious questions. And then you all meet back at the Donahue Road Conservation District Center, where there'll be food available, musicians, etc. So it is an all-day event, but you're in the car for part of it. It's very inexpensive, and we're really hitting some beginning times of fall foliage, and so it'll take you through some of the most scenic routes of Westmoreland County. And so that's my shameless plug, I guess, for the day. And that's all I have, Alyssa.
Doug, most importantly, food trucks. You mentioned food, but this is going to be food trucks at the Donahue Center, so it'll be a fun day.
Correct. My colleague is right. You would have to pay for the food in addition to the little entrance fee that there is. But there's supposed to be a selection of great food trucks there. Of course, I don't remember any off the top of my head.
Well, thank you very much, commissioners. And Westmoreland Ramble sounds like a really fun event. So I'm really glad you shared that with us. Thank you very much. Moving on to Dr. Carol Fox from the Chief Medical Officer of Excella Health, also a wonderful community partner and resource, and happy to have Dr. Fox here with us today and taking the time to talk about the health.
Good morning, everyone. Happy to be able to be with you on this beautiful sunny day. When we look at our COVID trends, I would say they're flat to very slightly declining. I don't think we're ready to declare victory just yet. in terms of the testing that Excella Health performed, 17.1% of our tests in the month of October have been positive thus far. When we look at the ages of individuals that we are finding COVID in, about 25% are less than the age of 24, and about 54% are less than the age of 50. And that's a pretty significant shift from what we were seeing about a year ago. Excella, unfortunately, has experienced 11 mortalities in the month of October related to COVID-19. 3 of those individuals were under the age of 64. If you look at statistics provided by the State Department of Health, approximately 2% of school-aged children have been diagnosed with COVID-19 since the start of the school year. So that's a little over 1,200 children. When you look at vaccination rates, according to the CDC in Westmoreland County, of all individuals who are eligible for vaccination, so that would be people 12 years of age and older, about 72.4% are partially vaccinated and 60% are fully vaccinated. What I consider to be the really, really good news is that for the population greater than or equal to 65 years of age, 99.9% are partially vaccinated and 79.7% are fully vaccinated. So it does look like we've been very, very successful in getting our most vulnerable individuals vaccinated. There are many locations where individuals can seek vaccination. Many of the retail pharmacies have vaccines, and Excella is providing those vaccinations at the former Galaxy Fitness Center in Norwin. That can be accessed in terms of making an appointment by going to the web, www.excellahealth.org, or by calling 724-689-1690. In addition, with great collaboration from emergency management and the United Way and 211, individuals can contact 211 for assistance. And that's a program that's been going on for quite some time. And we do have the ability to actually take vaccines to folks who are shut in so that they can be vaccinated, whether it's their first shot, their second shot, or their third shot, or a booster. Sometimes people ask questions about what's the difference between a third shot and a booster shot. They're the exact same vaccine for Pfizer, and that's the only one. Pfizer is the only vaccine that is currently approved to give both a third dose and a booster dose. And really the difference is it's really in the name of it, and it's based upon the functionality. So for individuals who have significant comorbid conditions, and in particular who are immunocompromised, it's the studies show that the initial immunity achieved by only 2 vaccines is not as high as we would prefer. And so a third vaccine is recommended in order to achieve those higher immunity levels. For those who are not immunocompromised, typically they do achieve very high immune responses after 2 vaccines, or 1 vaccine if it's a Johnson & Johnson vaccination. So a booster is designed to boost those levels once they wane over a period of time. Currently, Pfizer is the only vaccine that is approved to be used as a booster. We anticipate learning more information about both the Moderna and the Johnson & Johnson vaccines in the coming weeks. We also anticipate learning more about the potential for vaccination for children above the age of 5. Again, all those things we anticipate learning more specifics about sometime in the month of October. So, things are progressing. I'm happy to say that they're not getting worse at the present time. I would continue to encourage everyone to be vaccinated and to wear masks when they're around others, whether they're vaccinated or not. And we're here to serve you and help you, and we have resources that can help you should you need it. So thank you.
Thank you very much, Dr. Fox. That was a great report. I'm happy that the vaccination rate has been going up, and those are great numbers. And also thank you so much for explaining the booster third shot. That was really helpful. So appreciate your spending time with us on these calls and helping us to understand where we stand with the county in terms of vaccination and rates. So thank you. And now turning it over to another great partner of ours, Bud Mertz, from the Director of Public Safety for Westmoreland County. Good morning, Bud.
Good morning. Thank you. And good morning, everybody. It's good to continue to be part of this process and sharing all the critical information so we have a good idea of, what our status is with the COVID virus going through. Our 911 report that we have, September, unfortunately, was the second highest on our call volume for Zulu calls. I think I've mentioned what we defined Zulu calls is when somebody dials 911, and as we go through our call taking protocols or EMD, we determine that they either have symptoms of COVID or they mention in the conversation that they have tested positive for COVID and require an ambulance to respond to their residents. In September, we had 189 Zulu calls. So that's the second highest for 221 for 2021. Going back to, I think, January was the highest at 364. So right now we are, for October, we've had 81 Zulu calls so far, and so the mid-month, and so hopefully we'll be under that September number if the trend continues, but still a high number. So we continue to do the the interview process with our callers for EMS so that we can relay the information to the first responders, the EMS people. Although the EMS protocol is and will continue to be that they wear PPE on all calls, at least you have a better idea of what they're going forward with. As far as our EMS calls itself, we've had a slight increase of EMS calls coming in. Our average in October is at 120 per day. Which is slightly, it's before we were averaging between 104 and 107. So in October already, our daily average is at 120. So we're seeing an uptick on that. And obviously, the flu and other things, other calls go along with that as well. But still, we monitor the Zulu calls, we monitor the EMS calls, and so that we can properly be aware and make any adjustments or any contingency plans if we see that our EMS agencies are becoming overwhelmed. So we'll continue that as well moving forward. Our county public information and outreach for our department, as well as our county IT, continue to share the Department of Health data as well as Excella Health data as far as a number of cases in the county from the Department of Health and the cases that are in Excella Health. We share that on the county webpage so that the public can have a good idea of what is going on in the county as well. So that continues. And finally, I just want to mention we're going through right now a line of duty death incident in Westmoreland County for one of our first responders. The Jeanette EMS paramedic Bill Sikora passed away through COVID on last Friday. The details were forwarded to the Department of Health's EMS division, who felt that the conditions of that death was COVID related and is treating it as a line of duty death due to his work with as a paramedic. So the Department of Public Safety is supporting the Jeanette EMS as well as the Penn Township emergency management officials tonight and through tomorrow with the funeral services to give the honors to paramedic Sikora as a line of duty death and for his services that he provided. So that's a sad note, and it just gives us a thought of how vulnerable everybody can be, and especially those in the front line. So wanted to mention that so you can keep Bill's family and as well as his colleagues and EMS family in your prayers going forward. That's all I have. Thank you.
Thank you very much, Bud, for sharing that. And I'm also very sorry to hear about Mr. Sikora's passing. That is very sad. Thoughts with his family and friends and colleagues. And thank you for covering that and including that for us to know. So moving along to Jennifer Miller, Chief Executive Officer. And Jennifer, I think, are you now have a new name with the Westmoreland Food Bank?
We do. We are still the Westmoreland County Food Bank, but now we are known as the Westmoreland Food Bank. We felt that it was time to change a little bit. We're going to be celebrating our 40th anniversary next year, so we're planning some events around that. But yes, we are the Westmoreland Food Bank serving Westmoreland County. It's an exciting time. We received a grant for some outreach and some branding efforts, so that makes it a little easier to do that. So, but thank you for pointing that out. Things at the food bank are still very hectic. The virus feels like it's just never going to go away. Hopefully soon we'll hear even better news from Dr. Fox like we did today. The SNAP application assistance program seems to be going through the roof. Just through the month of September, we did 73 applications alone. That isn't our high watermark. Our high watermark was earlier in the year. We've been doing this program since 2015, and the estimated amount of SNAP benefits generated because of what we're doing is over $6.8 million. So that's $6.8 million that's going back out into the community to support revenue at our local stores. So we're really very proud of what we have been doing with that program, and happy to be partnering with the CAO to get that out to our community. The Senior Food Box program, as many of you may have seen, are partnering with the DoorDash Corporation. This is a statewide effort, and it was launched here in Westmoreland County about 2 weeks ago with Secretary Russell Redding from the Pennsylvania Department of Agriculture and the Second Lady Giselle Fetterman. It was a really nice event, and we were able to put the first box into a DoorDash car to take to one of our local residents. We are doing well. We did 5 DoorDash deliveries yesterday, and I think there's more today. But there's still room for our seniors to get involved in this program. And we've been doing an Adopt a Senior program too, because DoorDash is great, but we still need some more help with getting some of those food boxes delivered. And one of the barriers to the Senior Food Box program is a lot of seniors do not want to go to a food pantry, but could still use the help. So those deliveries are even more important right now, more than ever. So if you know of anybody, or if you yourself would like to get involved, please contact Michelle Heller. She's our Director of Programs at 724-468-8660, extension 25. And she will be able to get you arranged with delivering a food box. This can be done, you don't have to come to Delmont. It could be done at your local food pantry and your local community to be able to take it to someone that lives a little bit closer to you. So, but you could also come to Delmont to pick it up as well. We appreciate it no matter what. Our numbers are steady within our food pantry distribution program. The SNAP program being at max benefit has really reduced our numbers drastically. We heard from a lot of people that they are in need of a lot of paper products that food stamps can't buy. So we really are ramping up, our response to what this is going to be like when the SNAP outreach, or when the SNAP max benefit is no longer there. we feel that we are going to see a high demand in what the need compared to what we are right now. Where they're still seeing too many people, meaning there are too many people that are food insecure. So, the need is still very, very high. We are also ramping up for the holiday season. We were a little worried about getting our turkeys in and everything in time for the holiday, but the turkeys are here and they're ready to be distributed. We are also receiving some of our holiday, side type of food, as well as for our Christmas endeavors with the food box. So we are good to go. We don't see any shortages right now, and that's because of the way we buy. We buy far in advance, and we're able to get lower prices that way. And we are able to get it at wholesale prices or better because we buy in tractor trailer load quantities. So that really makes it a lot easier in terms of supply and demand for us. So we are good to go there. The weekend backpack program is ramping up as well. It's just always a slow start at the beginning of the school year, but even slower now with the pandemic and getting readjusted to what life is like to be right back into school. So other than that, we are doing well. Always a need, but we'll be here for it. So thank you.
Thank you very much, Jennifer. It's just great to see how the Westmoreland Food Bank meets the needs throughout the community and in every way. I was actually just reading an article yesterday. I'm going to send it to you about a food bank, I want to say in Kansas, that has a special program for people with food allergies. Don't know if you had heard about that or know about it, but it was really interesting. So I will send that to you afterwards.
Thank you. We did, early in the pandemic, we heard a lot from people that were celiac and have some special needs in terms of their diet. And because, with the shortage that we're in the grocery stores, they weren't able to find those type of items very easily. So we were able to do what we could. They rely on, like the big box stores to get those types of meals. So for them to be able to have to go to some of the higher price places was unaffordable. So if we didn't have some items available for them, we were able to give them gift cards to be able to go to those places to help meet their family's needs. So I would be very interested in seeing the article. Thank you.
Yeah, you're welcome. I thought it was very interesting, something I hadn't thought about before, but certainly, as you point out, a need for people. So
and it's more prevalent now than ever with food allergies and celiac disease and gluten-free because of health reasons. So we want to be able to accommodate that and keep improving on that plan.
Yeah, great. Thank you, Jennifer. Good to see you today. And as I mentioned earlier, Deb Thakra is also unable to be with us today, but she sent me a quick report on Feeding the Spirit. They continue to distribute 200 plus meals each week. Their meal distribution numbers are staying about the same weekly with no increase, but they have seen an increase for for rental assistance and emergency hotel placement. So I know that's been a concern for Deb and for Feeding the Spirit for some time, and always hoping to be able to make sure that people who are seeking out that help can get at least an overnight stay or more just to be out of the cold. And speaking of the cold, we are going to be ramping up for the cold weather shelter that United Way partners with Union Mission and Welcome Home and others to make sure that when it gets below 25 degrees outside, that people who are homeless can get emergency assistance and into a placement overnight. So more to come on that, but we've been doing that program now for several years, and it's been a great help, I think, to the community. Next we have, speaking of housing, is Dan Carney, the Executive Director of Union Mission. Dan, are you with us?
I am. Thank you so much for having me. And thanks for doing the cold weather shelter announcement. I appreciate that. That will be starting, as Alyssa said, November 1st, and we'll certainly get more information out about that. The housing programs in the county continue to operate. I know most of the interest is around rental assistance and the ERAP program. That program is continuing to operate. we've distributed nearly $4 million to date in assistance for rent and utility help. And we have about another 500,000 ready to kind of go out the door here almost. So about 4.5 million through that program has been sent out into the community. And we're in the process of expanding a couple of things. One is that the program, when it was originally launched, we had started with 12 months of assistance, but it does allow for up to 15 under the ERAP 1 model. And so we've gone back and taken a look at all of our applicants and are working to make sure they're getting that maximum 15-month benefit. And the county did receive some additional funds for the ERAP 2 program, which we've contracted with and are working on getting that funding secured on this end, and that'll allow us to go to 18 months of assistance for folks as well. We plan to kind of attack the ERAP 2 program under 3 prongs, one being that additional 3 months of assistance that folks might need. But the ERAP 2's legislation has a little bit more flexibility in terms of financial impact and will allow us to also review those households that didn't qualify under ERAP 1 who will likely qualify under ERAP 2. ERAP 2 requires a financial impact during the pandemic, not indirectly or directly caused by the pandemic. So we believe that that flexibility will allow us to go back to certainly those folks that we've already denied for ERAP 1, and then as applications are coming in, be able to filter out between the 2 programs how we can maximize the benefit for those households. When you look overall, we also have partnered, with the Housing Authority and others, and the Housing Authority has been administering some of our CDBG funding for subsistence payments for rent as well. And we've distributed about 300,000 through that program to date. When you look at last year with the CARES rent relief program, there was about 1.3 million that was distributed out into our community. So as of today, across those programs alone, there's a little over 6 million that's been put out onto the streets in the county for rent assistance and utility help, not including all the other programs that operate regularly. So the homeless assistance program through the Housing Authority, the work that Catholic Charities and the Bethlehem Project do, some of the other housing programs that are operating. So, we feel good that money has hit the streets. We did see an increase this past month in applications. Actually, we had 100 more applications in September than we did in any other month preceding. And a lot of that was because PUA benefits were ending for folks. That was the number one reason people that we saw kind of as a theme, people applying saying, hey, I've been paying my rent or I've been paying these utilities, but now I don't have the resources to pay that forward. There are still challenges in folks returning to work with childcare and other barriers, even some of the schools that are still hybrid. And so that childcare remains a challenge for them. So being able to support those households in this transition is extremely important. We're on target so far here in October to exceed the number of applicants that we received in September. So we have so far in September received a little over 200 applications. And we have about 130 folks that are somewhere along the process. So as the applications are coming in, we're getting them out as quick as we can. One of the questions that continues to come out is the kind of expediency of getting these applications out on the ground and funded. And we go as quick as we can. We have to double check as much as we can their income eligibility, the fact that they're in a rent situation. So there's documentation and COVID impact, of course. And we do work with households to take as much self-attestation and work with them to get that information as quick as possible. We have to prevent against collusion and fraud and people just taking advantage. And we have flagged less than 10 cases for that. So we feel pretty confident that the people who are applying definitely have a need. And it's taking us an average of about 2 weeks to process and get all the pieces we need. And a lot of that is just hang up sometimes from the landlord in terms of getting a ledger in or getting certain pieces of information from the tenants. So we kind of bombard them with calls and emails to get that. Even those attestations, where we have them sign a document, sometimes take a little while. If you're working with someone in the community that has a question, certainly don't hesitate to reach out. They can check their application status a lot of times if they applied electronically online and kind of see where they're at in the process. They'll be getting a message from the reviewer at certain points in time as well as they're going through that queue. But we want to make sure that folks know that we have a need. We've also distributed applications out and so the magistrates will have the ability to expedite paper applications through that process. And that way we can flag them as they come in. Within the system as well, all the applications are weighted and scored per the federal guidelines. So we do pull those in terms of their score. The federal government's prioritize those that have been on unemployment for a period of time, those that have the lowest income, and those that are facing eviction as kind of the three main prioritized functions within the system. So we're trying to meet all those benchmarks, but we're excited we have more funding and a little bit more flexible pot. Of course, it's smaller, so we have to be careful to still use those ERAP 1 funds to help us through that process. Other than that, the programs for shelters and rapid rehousing, permanent supportive housing continue to function in our community and operate. There's been some additional hoteling going on to Deb's need and what we're seeing across the shelters, Welcome Home using and Union Mission, just to support people who are in need of shelter space. We actually have someone who's in isolation quarantine right now as well. So there is the option for emergency shelter programs who need to isolate or quarantine. They don't have anywhere to go. And so those programs have continued to run and be available. So we're just glad to have this opportunity to share and to continue to partner with everybody to get the need out, to get the money out to those that are in need.
Great. Thank you so much, Dan, for all your work in spearheading that over and above your usual job of running Union Mission. So great work in the community. I know always looking for more partners and help in getting the word out. So thank you so much for being with us here today. And that concludes our reports. I just wanted to point out the next slide, we have upcoming calls already scheduled. If you have accepted the invitation, then you will be automatically, from what I understand, and Edward, you can correct me if I'm wrong, you will automatically be receiving the calls on your calendar each month. So next call is November 11th, which is Veterans Day. And then also again, December 9th, again at 8 a.m. If anyone who's on the call has some thoughts or questions, please put them in the chat or send an email to me or McCray. And if there's groups that would like to present or other information that you think would be helpful for us to include on these calls, we're always willing to hear that and to help get more information out into the community. So with that, I will say have a great day and thank you so much for all the great work going on in this community. I know so many people are being helped because of the efforts of those who are on the call and others. So take care and have a good Thursday. Bye-bye.